Hello and good evening. Today in this video we will see regarding the hyperuricemia and the diet to follow. There are a lot of questions among the patient and also among the postgraduate residents regarding the dietary counseling and whether the drugs once started will it be stopped or not, what are the ill effects of uric acid. All we will see in a series of video in the uric acid topic. At least in the first and second video we will see regarding the dietary factors which can have an impact on the uric acid level, because the number of patients with hyperuricemia is increasing day by day. So better to have this conversation related to the diet. Let's start one by one. See, what is the normal uric acid level? The normal uric acid level is approximately 2.5 to 6 milligram with 1 milligram up and down, or it is for gender variation. You can take up to 7 milligram per deciliter is normal. So the kidneys play a major role in the excretion, and there is always a balance between the uric acid production from the body cells and also from the dietary sources and the excretion, so that the balance is maintained. When hyperuricemia occurs, when the blood uric acid level goes high, whenever the production increases, usually because of the abnormal body cells or excessive diet, or the excretion is decreased. So simple concept, either the production or the generation or the dietary source increased or the decreased excretion. These are all the common causes for hyperuricemia. Many young patients are having hyperuricemia, because of which they were having joint pain and other manifestations of hyperuricemia. So first of all, what are all the possible causative factors we will know, which are very easy to reverse or treat. First one is the obesity. A high BMI is one of the important risk factors for metabolic syndrome, and also it have an impact on blood uric acid, which leads to hyperuricemia. Even a drastic weight reduction will also result in high uric acid level. So obesity, one of the important factor. And the next one, alcohol, beer or any kind of alcohol excessive intake, if it is there, probably it put a certain amount of stress related to the uric acid level, which rises the uric acid level. A high amount of alcohol intake lead to high uric acid level. Why I am telling it one by one, so that you will come to know whether any of this causative parameter is there in the patient, or if you are seeing the video for the high uric acid level, make sure that these are all the parameters which can raise the uric acid level and you have to avoid it. So coming to the third parameter, the third factor which increases the uric acid level is excessive intake of seafood, especially fish, because this contains high amount of purine. A high purine diet increases the uric acid level in a above the normal quantity. So if you are having hyperuricemia, better to avoid the fish for till the time the hyperuricemia, the reversible factors are treated, till the time the gout is settled. Red meat, any kind of red meat, chicken, beef, the important components of the even in mutton, probably a liver fry kind of things have to be avoided, because this also contains an excessive amount of purine, which leads to hyperuricemia. So avoid the red meat, avoid alcohol, obesity. And coming to the fifth one, high cheese item, cheese, excessive intake of milk, egg can also cause high purine load. So the milk, the cream have to be removed before consuming the milk. So if you are high hyperuricemia, better to remove the cream than take the milk, and avoid high cheesy item. Number 6, which can precipitate, is the drugs. The drugs, as a medico, you should know what are the drugs which interfere with the secretion of the uric acid. First, aspirin. Well, write it here. So what are the important drugs? First is the aspirin. Another commonly encountered drug, that is diuretic, thiazide diuretic and loop diuretics, steroids, and any kind of chemotherapy can cause high uric acid. Commonly in the OPD, we will be handling thiazide diuretic. Many a times, chlorthalidone component, which is added with the antihypertensive drug, might lead to high uric acid level. Many a patient comes with asymptomatic hyperuricemia. They might have read the kidney function test. In that, the uric acid might be more than 9, 8. The patient might be saying he's hypertensive and he is on Telma-H. Telmisartan H is hydrochlorothalidone. So always look for these culprit drugs. If it is there, probably that might be the etiology for the high uric acid level. So this we have seen. So coming to the seventh factor, which is the excessive amount of high purine vegetable diets like cauliflower, mushroom, peanuts, and spinach. So these hyperuricemia or gout is not exclusively a disease of non-vegetarians. It can occur in vegetarian also. Probably a genetic cause. The decreased excretion of the uric acid might be because of the genetic cause or because of some renal dysfunction. And even though non-vegetarian diet provide a high amount of purine supply, some vegetarian foods like this spinach, peanuts, they have excessive purine. So avoid these in excessive quantity. Taking a very minimal quantity doesn't have much impact. Avoid taking frequently, and if the patient is affecting from gout, which is the manifestation of the hyperuricemia, better to avoid this. Last one. So the important reversible factors we have seen, apart from this, certain endocrine conditions like diabetes, hypothyroidism, and in detail further discussion will take to the some malignancy type of thing. We will keep the discussion simple. So common condition diabetes, hypothyroidism can also cause, and excessive sugar, more important. Many of the patient will say they are not taking the meat, they are not taking excessive cheesy item, but still they might be taking excessive amount of carbonated and processed high sugars. This will interfere with the excretion of uric acid, which might lead to high uric acid level. So this is very important. Avoid excessive sugar intake. Many of the UG students who had a treatment in the last few months, at least if you are seeing this video, avoid excessive sugar even though you follow the diet as advised. But taking excessive amount of these kind of donuts, excessive processed foods, carbonated drinks might increase your uric acid level. So avoid it. Try to reduce the sugar in the milk or coffee, your tea, reduce the sugar. High carbonated, sorry, highly processed, high sugar contents have to be avoided. And the final one is the excessive amount of stress also might lead to some time variations in the uric acid level, hyperuricemia. So these are all the important causative factors. And the last one, even though you follow all the diet strictly, still there is a chance of high uric acid level in the blood. It might be because of the genes, where the channel which is excreting the uric acid in the kidney probably bit mutated and it is not excreting in required quantity. So these are all the important factors which leads to hyperuricemia. So a patient have to avoid these reversible factors. Leave out the genetic, leave out the endocrine causes. Rest you can try to bring it under control. And in till now I have shown what are the things to avoid. Now question comes, sir, at least tell what to take. Take it. We will see what are the things to manage, things to take. So how to manage? So first of all, look for whether the reversible causes of hyperuricemia is there or not. So one thing I have missed is hyperuricemia. So far we have seen the factor which lead to the hyperuricemia, but if there is a kidney dysfunction, yes, kidney won't excrete. That exclusively is a renal dysfunction topic. Probably yes, CKD patient will also have hyperuricemia. So that completes all the etiology of hyperuricemia. Then here coming to the management. Mostly the medico residents that I am treating, most of them are in obese range. So check your BMI. Even if you are in overweight range, try to bring it to the normal range, which is the normal BMI of less than 24. Try to bring it over here. So this will have a huge impact. Don't try to bring it very drastically. That will also cause a high fluctuations of the uric acid. So try to bring it over 6 months, 1 year. Keep a weight target practical, possible, achievable. Don't keep some excessive weight target which can't be achieved. So keep a possible, achievable weight target. Second, you should take at least 3 to 3.5 liter of water per day, which is very very good to the kidneys, thereby the excretion of the uric acid or whatever the dietary load that you are having probably is well excreted. So second is that taking a good quantity of water is very very important. Third, legumes. You can take legumes. Just Google it out. What are the legumes cookable, possible, that you can either get in the hostel, or if you are at home, tell your parents to make it. Fruits like apple, all the citrus fruits which are which are rich in vitamin C, pineapple, these are good for the hyperuricemic patient, have an impact in reducing the blood uric acid levels. Fifth one, whole grains. Like here is the list of the whole grains which are possible, like rye, apart from that brown rice, and which in the oats, whole wheat, and you can go through the list of whole grains whichever possible in your area. You can include these in your diet, at least 20% to 30%. You can try to convert your snacks into these items rather than the carbonated burgers and all, sorry, carbonated donuts, carbonated drinks. Apart from that, a summary like important uh, dietary things which are helpful in hyperuricemia is vitamin C related foods, pineapple, even ginger, lemon, turmeric. Try to include this in your dietary habit. So these are all the important dietary things you have to include. So in the initial part of the video, we have seen what are the diets to avoid. Then in the later half, we have included what the diets to include. Mostly focus around your BMI. Avoid the high purine foods. Mostly in summary, include high, sorry, high water, vitamin C related food items, legumes, whole grains, bring the BMI under control, avoid stress, a good exercise, a good 30 minutes exercise is very, very helpful in improving the metabolic functions of the kidney. So, what are the things to avoid? We have seen over a period of 8 to 9 slides, starting from alcohol, meat, seafood. So if one of the reversible causes there, probably uric acid will settle down over a period of time. So once it is achieved, obviously no need for any other drugs. After following these for a period of 3 to 6 months, despite if there is a high uric acid level, probably some channel defect might be there, drugs might be required. Apart from this, probably this might be more than enough for a lifestyle modification, and I hope your uric acid level should come down, or the patient that you are treating, the uric acid level should come down. And wishing you all a good health, and at least try to include exercise, stress-free life, and check the uric acid level at a period of 3 to 4 weeks to have a significant change. In the next video, we have some discussion regarding the impacts of hyperuricemia on the body.